I'm here with Dr. Rob Conenello. Rob, it's great to see you.
Nice to see you, Pete.
Rob's joined us kindly from Orangetown Podiatry. My name's Pete Turnbull. I'm one of the founders of Sersha. No one can actually pronounce the company name, but it's Scottish Gaelic. It stands for freedom. The reason we chose freedom, we'll talk a little bit about it today, but freedom is synonymous with Swift, and we're really trying to provide freedom for patients. So I really appreciate you being here, Rob. We're going to talk a little bit about Swift and your experience with Swift in this great setting. How long have you been using Swift for now?
So I've been using Swift probably for the last 9 months. Was introduced to me at the New York Clinical Conference in 2018, and since that time I've experienced about close to 60 patients dealing with this. I'll be honest with you, when I first started dealing with this, I was a little tentative, to be quite honest, because I wasn't sure whether or not it was going to be something that really worked, because we've been promised lots of things in the past,
of course, that
will work well for the HPV virus and for warts in general, but it never really came to fruition. Since using this product over these last several months and having all this volume of patients that we could see makes a difference, been really, really happy. Been able to see the change in these individuals who came from people who had like multiple different types of treatment and nothing worked, to individuals that were so happy that they're referring others.
Right.
It's been really, really positive.
We keep hearing this conversation, which is similar to what you've described, and it's about the Swift journey and the Swift experience, which has to be relative to something. So we'll talk a little bit maybe about the Swift experience for your patients in a second, but tell me a bit about the common experience that you were running through with your patients before Swift.
Yeah, so I'm 30 years in practice, in private practice, and my practice is based around sports medicine, highly active individuals, a lot of youth patients, athletes in general, if they were professional athletes or just someone who's just trying to lose some weight. We've had these individuals. So these patients usually come to me with a problem like a verruca, a wart, and they're so frustrated because they've tried everything. And especially my highly active individuals, such as swimmers and triathletes, they don't want to have to be dealing with things such as using medications and putting tapes and things like that on their foot, because it just, to be quite honest, it's kind of uncomfortable and it's kind of embarrassing.
Yep. So,
and the reality is that we have not been able to see a huge improvement. I think I would have to say it's probably about a 40% success rate doing things that way, in the old-fashioned way. But now, since having these individuals come, we're able to offer them a new technology that say, hey, we can do this type of treatment and we can get you cured, not just treated, but cured in 3 months.
Right.
So that's been super positive. I'll be honest with you, in the past, I was always kind of frustrated when I would see on my schedule that there was a patient coming in with a wart, because I would say, what am I going to be able to tell this patient honestly? How am I going to really get them better? And I knew it was like a process. We would, like we said, we'd give them medications, we would freeze them, we would maybe cut them out, and then there was always recurrence, or there was a situation where there was non-compliance. So that was very frustrating. Now I see a patient comes in and has a wart, I'm kind of energized. I'm like, I can't wait to see this patient, to teach them that there's a new option, that there's a new tool in the toolbox that can really make a difference, and it's truly been a game changer for those type of patients.
Okay. For those people who may not be as familiar with the method of action and how we're approaching the lesion with Swift, you mentioned providing a true cure. Do you want to just explain what that sort of means to the patients when we're talking about Swift immunotherapy?
Yeah, so in the past we would just treat the skin. We would either beat up the skin by using some kind of acid, like salicylic acid, or cryotherapy. These are therapies that have been around for more than 50 years, and the success rate has been not great, to be quite honest. And that was just treating the skin, or even if we were to excise the lesion, the recurrence rate was really super high. So now we're utilizing the Swift treatment, which actually attacks the causative issue. Instead of worrying about what it is, it's a wart. Why is it? It's a wart because it's an HPV virus. Now we're attacking that HPV virus. We're uncloaking it and letting our own immune system fight it. So that's super exciting to see how that can work.
Yep. Now I know you were someone, your credibility is obviously very important to you. You're a man of great ethical standing. Maybe tell the folks about sort of your experience in getting to know Swift and making sure that you vetted out that technology before you put yourself behind it, or before you started presenting it to patients.
Yeah, so I didn't want to just go to my patient and say I have this really neat new trick that we can work with. I wanted to make sure it worked. So what was really nice is that the individuals like yourself from Swift, they offered me an opportunity to utilize this system and see if it really made a difference. And we presented to the patient and told him that at the time it was something that was new to us, and I wasn't really sure how it works. But thankfully, I have good communication with my patients and a good trust factor. And they said, "Listen, we're going to give it a try." So we picked some of our most recalcitrant patients, the toughest ones that we have seen for long periods of time, that nothing has worked, and they've become frustrated. So we used it on those patients. And we documented each one of them. We took pictures before and after and during, and we followed their journey. And along the way, we were some bumps in the road in that we didn't know exactly where we were going to wind up. But thank God, every one of them have become extremely satisfied, and we've turned these individuals into positive results.
Yeah. It's been an interesting experience for me being a part of this, and we launched in the U.S. market really in January of 2019. So it's been less than a year, and what I've been amazed by, and this is something I didn't know, but as we hear more and more of these patient stories, you realize how emotive warts can be. And how frustrating, you mentioned the word frustration, and that's really where we're seeing that uptake. Can you maybe share one of the stories that some of your patients have had where they particularly had a strong emotional response, or where Swift has delivered some emotional value to them?
Yeah, I could give you a couple different ones. So one of the ones was an individual who was a high-end runner, and he was a triathlete actually. And he was really frustrated because he couldn't get past that next level because he has this lesion. It was right on his heel area, and it was not helping him at all. So he was not open to doing the traditional things. So when we offered him this, he was a little tentative because his movement, his running is so important to him.
Of course.
So when we were able to give an option like this and then start to see the changes in 1, 2, 3 months down the road, he was able to reach new goals. And that's it with every one of my patients. I always ask every one of them, what are your goals? So this individual was to set a PR. For someone else it might be just to function in life a little bit better without having the embarrassment of having this lesion on their foot. So that was one of them. The other one was most recently was an individual who came to me, was a young teenager with the mother, and we offered this to the mother, and the mother's like, well, I'm not really sure if I want to do that. I think I might want to go traditional way. And the teenager broke out in tears saying, don't you want to have the best possible outcomes for me? I was amazed that a teenager would say that. And the mother was like, had to sit there and think about it. So it's interesting that people want resolution. They don't want to just say, listen, we're going to see what happens over the next several months. They want to say, hey, this is our algorithm. This is how it's going to work. This is a cure. This is not just a treatment.
Yeah. In terms of cure, thus far, I suppose, how many patients, and then what sort of cure rates are you seeing?
Yeah, so I think I'm in excess of about 50 patients right now treating this. And my cure rate right now, I believe I could cure any one of my wart patients with the Swift product. Obviously, it's still relatively new, but we've seen such great outcomes already that I really feel as though my outcomes will be only even better as I get better at doing it. As of now, I'd probably say my resolution is closer to 91, 92%.
Yep, that's fantastic. When you talk about where you see Swift, its place in the podiatry landscape in the U.S. market, I know it's brand new and we've obviously just launched. Where do you see Swift going in your practice, and then I suppose to the rest of the podiatric community, sort of where do you see it fitting in?
So as a new adopter, I think at the very beginning I was like, well, we could try doing the traditional things and then we'll see how things move on. The more I become comfortable using it and the more that I see patients getting positive outcomes, it's my go-to. I say, this is what you need. This is the latest, this is the greatest, this is the cure, okay? And you make the decision. I offer that to the patient. And I think that as time comes on, this will be the gold standard, to utilize this first, because it's time to move forward and do things that are really going to make positive outcomes for your patient.
Yeah, no, it's fantastic. Robert, listen, I really appreciate your time. Thank you so much. You mean a lot to us and obviously to your patients. So thank you for doing this, for your time, and we'll look forward to reaching new goals with you as we move forward with Swift.
No, it's been a positive experience for me. I mean, the individuals at Swift have been nothing but top-notch in class, and that to me is so important because the bottom line, it's my reputation, and if I'm going to back something, I want to make sure that it's something that I believe in from my heart.
Appreciate it. Thank you, Rob.
Thank you. All right.
Cheers, man.
Good.